Hey guys, so today we're going to be talking about post-COVID depression. As one of my patients came to me, and he's a 70-year-old gentleman, and he said, after I've had COVID, I feel really, really depressed. And what do I do for this depression? And it's interesting. My last video was on headache stroke or post-stroke headache, actually. And then we learned about stroke and headache and the combination of headache and stroke afterwards. And now I'm talking about this patient who's a 70-year-old guy who's full of joy. He actually had COVID. He ended up falling on his head, and he has a bunch of microbleeds that are either related or unrelated to that situation with COVID. And what happened thereafter is that he basically started to talk to us about different agitation that he had. He couldn't see out of the left side of his visual field. He seemed to have some microbleeds in the right side of his brain. And so he asked me directly, what is it that your medicines can do for me in this situation and this post-COVID depression type of situation? And so what I decided to do is I decided to just go back to the basics with him. This is a monk, actually, that lives in India. And he said one of the biggest things that he's dealt with during this time is the fact that he gets a little bit more angry than usual. And it's not very usual for him to get angry because he's always sort of in this blissed out, peaceful mode. But now he's sort of more agitated. And what should he do? And in addition to that, he feels that he was a little bit unsteady. Is that when he's walking, he feels like he's veering off to the right side. So two different things here. The first thing, as far as the veering off to the right side, we know that the occipital lobe houses the visual fields. And if he's veering off to the right side, one thing that he could have is the fact that he's just not able to see very well on that side. And so that's why he's going towards that right side. The left-sided occipital lobe problem, not the right. He had the issue on the left. So what is it that's what's going on there that's causing that? The other issue is that he could have a retropulsion or a Wallenberg syndrome, which is pulling him to that side on the right. And so that Wallenberg syndrome is a very interesting syndrome, which has a slew of findings, one of which is an ipsilateral sensory loss, and then you have a contralateral weakness that actually takes place because it's a mixed syndrome. But I think the biggest thing that he wanted to talk about was how do you really change this agitation? And this is a phenomenal thing because his agitation and one of the things that preachers usually get is they get this form of and monks, they get this form of reciprocation that actually takes place, where at the level of, at the nano level of his actual soul, he's able to feel a feeling of ecstasy if he's able to impart the knowledge of the supreme science on somebody else, which pleases his super soul, and he becomes happy. Because he's not able to do that, because that flow of energy has stopped, he's becoming more agitated. And so it's interesting in this era where even those people who are seriously blissed out, and they're blissed out because they're preaching, once they stop their preaching activity, that link stops, and it's an unfortunate situation. So how do you sharpen that link? Well, one of the ways is meditation. So I said, just go back to the basics. And some of the basics are written directly in our book, Meditate or Die. And so it's something that I think that you should buy. It's a very, very cost-effective book. The link is below. Please click on it, buy it. It will help you, especially in post-COVID depression and post-COVID agitation. Now, the next part of this video that we're going to talk about is, what do you do with the visual fields? Is the visual fields actually going to get better? So there's some theories that say yes, the visual fields will get better, but now in a situation where he's actually fallen, he's hit his head, and he may or may not have a little bit of a stroke in the left side of the visual area, it's hard to say. It's only, I guess, time. And I think the rule of thumb is that if within a year you don't see improvement, then you're probably not going to see improvement. Now, that leads to the next question is, how can I create synaptic plasticity in that area? And this is something that's really interesting, which can go into sort of Elon Musk's chip that's coming on, is that the ability to stimulate the brain in certain ways can definitely develop synaptic plasticity, which then can lead to neuroregeneration on its own. And so I look forward to this kind of science taking place. Another thing that hasn't been tested as far as visual function is concerned, but has been tested at Stanford as far as motoric function is concerned, is the fact that by simply injecting stem cells, and you can look this up for if you go to Stanford stem cell study, we'll put the link below, is in the Stanford stem cell study, they found in around 30 patients that there was a motoric increase in patients who were post-stroke, and to increase the actual rehabilitation that took place. In addition to this, other therapies are actually being formulated, not proven, as sort of virtual reality that is actually being used for the brain, and that virtual reality that's actually taking place to help people with this post-stroke visual field deficits and whatnot. But nothing yet, as of yet, has sort of panned out as randomized clinical trials to actually increasing visual capacity after a stroke in the occipital lobe. So some of the promising things, of course, is Elon Musk's thought process as far as his company is concerned. Number two is the stem cell, which seems to have some clinical trials that are involved in it. And the third thing is something that you may want to try, because we're always focused on meditation, is focusing on the third meditation in our book. Focus on the third meditation in your book and see if you can concentrate in that area of your brain. And our thoughts are able to absolutely heal or destroy tissue at a certain level. At a certain level, you know that metaphysically, we're able to cause some increase or decrease or some response. So meditation is a great way to get started. Whether you'll be able to actually, bring your eyesight back or not is sort of a divine gift, but you can trigger at least some ease of that area by simply meditating and doing that third meditation in the Meditate or Die book. And if you do, when you master that third meditation, it takes about 2 days or 3 days to master. You do that, you will definitely find an improvement in your life, and maybe it'll actually cause thing in synaptic plasticity. Now, I'm not sure if that'll actually happen, but it sounds like it's a good clinical trial. We'll be putting a SurveyMonkey link below to all those who have tried it, and see if we can gather some data to those people as far as rehabilitation is concerned. Can you actually increase your visual field strength? We know for a fact in our trials, at least retrospectively, that you can feel better in a non-COVID setting with using the third and the fourth mantra. In a COVID setting, we know that those people who actually had COVID will feel better using these mantras. We know that for a fact, and we've actually studied that, and it's publishable data, and it goes over to our coronavirus anxiety group, which is also published in the link below. But in a post-stroke setting, we have a few people that are actually using it, and in a post-COVID setting, we know that people are actually using it. But in a post-stroke setting, we also know that people use it to feel better and to feel good and to decrease depression. We know that for a fact. So with all this data there, you can definitely help. Number one, you can help your patients with COVID-19. Number two, you can also help patients try to increase synaptic plasticity in a certain part of the brain. Thanks for joining.